He has 28 years of clinical experience, 21 years of teaching, and 16 years of research experience. His areas of research are musculoskeletal disease, lifestyle disease, allergic tadbir, psychiatry, and dermatology. He has supervised 627 5 PhDs. He has more than 100 scientific research articles published in peer-reviewed in-depth journals. Now, I humbly request Professor Dr. Mohammad Salimuddin Kufi sir to deliver his lecture. Over to you, sir.
Assalamu alaikum. Good afternoon to all of you. Before I start this webinar, I extend my greetings to the organizers of this webinar. Okay, this is actually the agreement between both of us has taken place that I would like to place something about the pharmacovigilance of ASU drugs, issues and challenges. And as the former speaker told about that we are literally sharing the same topic, but the content is different. I don't want to waste much of my time. I'm not sure of that what is the amount of time given to me for my presentation. Basically, the definition already both Nafis Khan sir and Mr. Tariq Mahmood sir has been covered. So I don't want to put the genesis. What makes us to think about the pharmacovigilance? There is a great history. In the medical history, we have incidents like the Hannah Greener, who was killed unknowingly with the use of chloroform as anesthesia, and followed by there is a historical medical adverse report associated with acetyl salicylic acid is used, and the major milestone in the field of pharmacovigilance was use of the elixir sulfanilamide among the pediatrics. The change in the dosage form causes loss of more than 100 children with respiratory failure. And again, the biggest incident in the history of pharmacovigilance genesis is the thalidomide disaster, which causes there is anomaly in the human birth of the people. And like Dr. Nafis Khan has already placed before the August audience, the pharmacovigilance program of ASU, that is Ayurveda, Siddha, Unani, Homeo drugs, started somewhere in the year 2004, particularly for the ASU, apart from this conventional system under the Institute of Postgraduate Teaching and Research for Ayurveda, Jamnagar. But due to certain constraints, the movement of this pharmacovigilance project was dropped. Again, this program has been a renaissance of taken place somewhere in 2017 as a central sectoral scheme under the Ministry of Health, Government of India. Today, as a parent part of the second initiation of the Government of India, we people are working extensively throughout India. Like Dr. Nafis Khan has already told, we have one National Pharmacovigilance Center, followed by 5 intermediary pharmacovigilance centers and 74 peripheral pharmacovigilance centers, out of which peripheral pharmacovigilance center, Lucknow, today we are going to meet all of this. The basic objectives are again specified by the pharmacovigilance of ASU drugs are the specific aim of this one is improve patient care and safety in relation to the use of medicines and all medical and paramedical interventions that is being used for the patient. Overall, if you look at that, the objective of the program is to improve public health and the safety is the biggest concern. Like my former speaker in the previous introducer has told about that, generally the conventional medicine is different from the classical or the old traditional medicine, particularly the Ayush drugs. We believe that all Ayush drugs are safe just because they have derived from the nature. But it is true that all the drugs which have been derived from the nature are not safe because they themselves have a number of toxic substances which is proved to be fatal, unexpected, unusual adverse drug reactions were manifested among the people who are consistently using these herbal drugs. With this being the objective of this program, which is initiated by the government, is to foster the reporting culture. People who are involved are the people of the health delivery or healthcare system, starting from the bottom to the base level to the highest. All the people are made responsible to develop reporting the culture of adverse drug reaction. Like that, we have an intermediary to involve large number of healthcare professionals, which includes practitioners, nursing staff, paramedical, all those people. And at the end, the government intention is to have something like a benchmark for the global drug monitoring. Particularly, we are going to talk about the Unani system of medicine. Of course, Unani system of medicine, India is one of the global capital for this Unani, but we need to propagate the system, we need to circulate the system globally, and for that we need to have data which ensures that the drugs used in the Unani system of medicines are safe, they are free from the adverse drug reaction. That's what we are looking for, the long-term this global drug monitoring. That's the long-term objective. With this, I don't want to waste my time. Like, this is the hierarchy of the work, how this pharmacovigilance program for ASU H is being instituted. We have our National Pharmacovigilance Center at the All India Institute of Ayurveda, Delhi, followed by IP, thus intermediary pharmacovigilance centers. 5 are there, out of which 1, National Institute of Unani Medicine, Bangalore, is being nominated as an intermediate center to exclusively work on Unani, apart from the other ASU system of medicine. We already shared this information. We have at the bottom submitted both our peripheral pharmacovigilance centers. This is the pictorially we are representing that the National Pharmacovigilance of Delhi, Jaipur and Jamnagar evidences for Ayurveda, and Bangalore is Unani, Kolkata for homeopathy, and Siddha is meant for the Chennai is having Siddha. Like that, throughout the India, almost all the states they have covered with one another system of peripheral pharmacovigilance centers meant for documenting, collecting the information and ensuring the safety of the people or the patients. I don't want to spend much of a time on the terminology which is often used in this pharmacovigilance program. Like, there is a general percept. People generally speak about side effects or adverse drugs or something like a similar. Dr. Tariq Mahmoodi has already explained about the side effects of giving the reference of atropine and several other drugs also. Adverse drug reaction, all these things keeping aside. Basically, we are focusing on adverse drug reaction, which is nothing but a response to a drug or any substance which is noxious and unintended, and which occurs at the doses normally used either for prevention, diagnosis, or for the treatment, or for any modification of the physiological function, what we are generally going to do here. My topic, what I am going to cover is issues and the challenges of the execution and implementation of this program, particularly with the Unani system of medicine. I thought to share some of the basic things and how we are working for the last 3 years to sensitize all the stakeholders, particularly the practitioners, teachers, medical students. This is a glimpse of my explanation here. In India, Unani system of medicine, I said already, if you look at the Unani system of medicine, I'm sure India is the global capital for Unani system of medicine with respect to what is called as the education, patient care, and research also. Apart from India, I think there are the countries which are neighboring countries in the Asian and the other countries are also equally focusing for development and adaptation of the Unani system of medicine because of its anecdotal and evidence-based reports of effectiveness. Practically look at that, in India we have around half of the century recognized government, private and the government institutions exclusively working for the imparting education. If you look at that, around 2,500 students per year being graduated, and some of them are going for the post-graduation and the PhD level also. That's what India is now excellent with the providing excellent education up to the post-graduation level. And there are institutions dedicatedly working for the research activities of the Unani system of medicine, which number to be nearly some 25 institutions are there all over India. And very happy to say around 50,000 Unani practitioners registered in different states. They are the graduated practicing physicians, and we have a good number also. The data what I am going to share is just provided by the ministry, updated in the June 2021 only. And now 15 state houses 263 Unani hospitals and 1,686 beds around this. And very happy to say there are nearly 1,028 Unani dispensaries across 20 Indian states, and particularly the central government hospital sector is also having 10 dispensaries managing throughout the world. This data, मेरा मकसद इन तमाम चीजों को हमारे क़ारीन और नाज़रीन को इस वजह से मुझे शेयर करना पड़ रहा है कि हम फार्माकोविजिलेंस के तहत जो चैलेंजेस, इश्यूज हमने जो महसूस किए हैं, हिंदुस्तान जैसे अजीम शान मुल्क में इसकी वसत में कई सारे प्रैक्टिशनर और कई तिब्बी तरीकों को इस्तेमाल करने वाले लोग मौजूद हैं, बिलखुसूस तिब्बी यूनानी के लोगों में हमने एक सर्वे कंडक्ट किया जिसके दौरान जिस सर्वे से हमने जो मवाद, जो मसाइल हासिल किए हैं और जिन मुद्दों को हमने अवाम उन्नास तक, पर्टिकुलरली यूनानी प्रैक्टिशनर्स, डॉक्टर्स, टीचर्स, रिसर्चर्स, इन सब से हमने शेयर किया, तो हमें पता चला और ये तमाम इंफॉर्मेशन हम आप लोगों से शेयर करना चाहते हैं. आई नीड योर अटेंशन, particularly Dr. Tariq Mahmood, Nafis Khan Saab and Mahbub Salam and other people, because I need your input for this one. Here, this one study, this is a purely digitally circulated, what is called as a Google form. We have circulated throughout the India in anticipation. All the people, teaching institutions, research centers, practitioners will actually be part in this one. And the questionnaire was kept for a month, complete 30 days. And luckily, I think there are only 1172 people interested to be participate in the study. Out of that, some only 1,082 people only responded to the study. 90 people denied this. इसका मतलब ये हुआ इतनी बड़ी मुल्क और करीबन 50,000 प्रैक्टिशनर, सालाना 2,500 ग्रेजुएट्स फारिग हो रहे हैं, बहुत सारे रिसर्च इंस्टीट्यूशन से जुड़े हुए हैं और भी लोग ताजिर भी हैं, जिसमें इन सबको हमने ये कम्युनिकेट करने की कोशिश की कि ताकि हम उनकी नॉलेज को, उनके इल्म को, हम उनके मतलब मालूमात को हम महसूस कर सकें. But unfortunately, we got only very few small data. This is around 1,082 only. And happy to place that इसमें करीबन हमारे 20 states के participants इस तरह हैं. And Tamil Nadu occupied 23% of the responses, followed by Bihar at 18%, Karnataka the 14%. We are the hosting here. And happy to say UP people, around 13% of the total sample was represented from the Uttar Pradesh, 12.1% from Andhra Pradesh. Like that, Telangana and National Capital Territory Delhi, we have only 1.2% of the population. इसमें इन लोगों से हमें रिस्पांस मिले. बाकी रियासतों से भी काफी लोगों ने, यहाँ तक हिमाचल प्रदेश से भी हमारे पास जवाब आते रहे. राइट. दिलचस्प बात यह है कि टोटल पॉपुलेशन जो 1,000 से ज्यादा लोगों ने इस सर्वे में हिस्सा लिया था, 62.7% स्टूडेंट तलवा रहे हैं, जिसमें से 25.37% पोस्ट ग्रेजुएट स्टूडेंट्स हैं. ग्रेजुएशन के बाद जो इंटर्न्स हैं 9.373% इंटर्न्स ने उसमें शिरकत किया हुआ है. बीएमएस 4th ईयर, 1st ईयर, 3rd ईयर और 2nd ईयर के तलबा भी, जिसमें कसरती 21.83% 4th ईयर के स्टूडेंट्स. हमारा मंशा था कि ये we would like to know that whether the 4th year, final year intern students, how much of a knowledge they have about the pharmacovigilance and about their own system of medicine. And luckily, we have a good number of the private practitioners, around 12.5%. People as a private practitioners, they responded to us, and I can say teachers, little bit poor response from teachers. The 11.2% teachers responded us. Medical officers who are working in a government sector, around 7.8%, and above all 8.1% other people also responded. This is the 100% of the responses what we got. And the purpose of our what we have got here it is, हमने स्कोर देखा स्टडी से देख के. And see, if the score people are getting less than 40% score, we categorize them as a poor knowledge about our own system and the pharmacovigilance. People who are falling between 41 to 60 average knowledge रखते हैं, and 61 to 79 score जो हमने देखा इसका जो क्वेश्चनर से, उसको हम गुड करार किया. Any person who is getting more than 80% of the score in the questionnaire, we categorize them excellent. If you look at the frequency and the percent, highest number, 38% of the responses what we got is good. Of course, our intention is to enhance this number, reducing the poor number. As a whole, the outcome is represented here. Just a moment. Okay. This is the graphically what it shows. This is 38% highest good responses were there. आइए हम ये समझने की कोशिश करें हमने उनसे क्या पूछा. How the people started to respond to this one. Okay, this is a problem. पहला क्वेश्चन मैंने उनसे पूछा था कि pharmacovigilance deals with.
Visible, sir. The slide is not visible.
Okay, the primary question we asked them, pharmacovigilance deals with. People responded that around 82.3% people. 1082 लोगों में इन लोगों ने जो हमें जवाब दिया that pharmacovigilance is the right answer, monitoring of the drug safety and other drug related problems. So we are very happy. 82% is good enough. People responded to us. Immediately then we have placed a question in India, the country where I consider itself as the global capital for the Unani system of medicine. And we asked who is monitoring the pharmacovigilance of ASU drugs. Either this one, the answer was Ministry of Health, Government of India, and we got the response is around 50.9%. This is really happy. But at the same time, if you look at this central drug standardization, the CDSCO, basically the CDSCO is responsible for the allopathic system of medicine and other thing. But people are well versed with that. There are certain agencies which are working for documenting about the pharmacovigilance program. We are happy because यहाँ 50% से ज़्यादा लोग ये जानते हैं कि मिनिस्ट्री ऑफ आयुष एक्सक्लूसिवली आयुष फार्माकोविजिलेंस प्रोग्राम पे काम कर रही है और फार्माकोविजिलेंस का मकसद भी लोग जानते थे. The second point is हमने उनसे कुछ चीजें जो बैनुल अक़वामी सतह पर इसकी शोहरत के मुताबिक हमने पूछा. The International Center for Adverse Drug Reaction Monitoring कहाँ है? तो हमें पता चला कि लोगों ने जवाब दिया 68% of the population they told about the Uppsala Monitoring Center. That is आ रही है. Is it Uppsala, Sudan? लोगों ने बताया. Is it visible, sir?
ये visible sir.
Oh, thank you. My voice is clear, is it?
Fine, sir. Perfect. Go ahead.
So here we got that 68% of the people responded that the International Drug Monitoring Center, adverse drug जो monitor करता है वो सुदान है. Very happy. Our audience, our participants are very good enough. We feel a little bit happy. But at the same time, some people say the 20% they stated that United States of America, right? And the another thing what we asked them is it correct to keep the drugs of exclusively herbal drug origin under the purview of pharmacovigilance? Because आयुष के जितने भी ड्रग्स हैं वो सारे हर्बल ओरिजिन है. आयुर्वेदा, यूनानी, सिद्धा, होम्यो, maybe it's something like a chemical extraction is there. But Indian system of medicine के जितने भी systems हैं, क्या उनको जो हर्बल है उनको फार्माकोविजिलेंस प्रोग्राम में रखना चाहिए? तो अक्सरियत लोगों की हमें जवाब दी yes. See, you look at the 78% of the population of the study, they said yes. We have to be the part of the pharmacovigilance because people they have very good thinking about it. But some of the 13% people ने कहा कि maybe रखा जा सकता है. Somebody say can't say because they don't have the clarity what to do, whether to do or not to do. But there are set of people, 6% of the population say no. We don't know why them. And further we have asked some other questions like in India, National Coordination Center for Pharmacovigilance Programme for ASU drug कहाँ से इस प्रोजेक्ट का रेखा दमल में आ गया है? जवाब था उसका ऑल इंडिया इंस्टीट्यूट ऑफ आयुर्वेदा दिल्ली. तो आइए तो लोगों ने उसका जवाब कैसे दिया हुआ है. सी दिस इज व्हाट इज कॉल्ड एज 63.7% पीपल आर responded out of thousands, nearly 700 people. They said that all India Institute of Ayurveda, and all these 70s, more than 60% and the 80% responses are. It is just because of the continuous awareness program is being conducted by the national agency, National Pharmacovigilance Center, with the help of intermediate and the peripheral centers like today what we are going to have. अगर आप हमसे पूछे इंटरमीडिएट फार्माकोविजिलेंस सेंटर यूनानी के तहत ही आज का इस प्रोग्राम को अगर हम शामिल करेंगे तो करीबन 3 दर्जन इस तरह के अवेयरनेस प्रोग्राम कहने का दमल में आया. करीबन हजारों लोगों ने इन प्रोग्रामों से इस्तेफादा हासिल किया. गर्ज़ो गायत यही है कि हमारे तमाम स्टेक होल्डर्स, medical students, practitioners, professionals, pharmacy people, they should be aware of what is this pharmacovigilance, how this pharmacovigilance will help you to strengthen your science. And somebody said that this is up to 18% people are also talking about that the CCRM is the center for this. This is very unfortunate and unlucky because बहुत कम लोग जानते थे. लिहाजा हमने मजीद इनसे सवाल पूछा कि आप जानते हो हिंदुस्तान में 5 इंटरमीडिएट फार्माकोविजिलेंस सेंटर्स हैं, जिसमें यूनानी का सेंटर कहाँ है? जैसे आप सब जानते हैं नेशनल इंस्टीट्यूट ऑफ यूनानी मेडिसिन बेंगलुरु है. आइए इससे मुताल्लिक लोगों की आगाही कितनी रही है. There is only 47.9%. This is very bad on my part. because I think we are unable to representing the people. See, look at the Central Council for Research in Unani Medicine has nearly got 36.9, 37%. There is only marginal difference of 10% of the population. They are little bit something like an ambiguity. लोगों में थोड़ा सा confusion overlapping था. लोग समझते थे कि भाई Central Council CCRU is basically the intermediary, but for all of them we are just what is called as making them to learn that Central Council is a big organization under which there are different centers, and the majority of the peripheral pharmacovigilance centers are under the Central Council for Research in Unani Medicine only. So here, the National Institute of Unani Medicine is the intermediate pharmacovigilance center, which got less than 50% of the representation from the people, right? And the basic question, like Tariq Mahmood Sahab ne bataya, we ask the people, are adverse drug reaction and side effects same? I'm very happy to say people said no. This is a very literal question. This is very happy. 61% of the population told there is a no, in the sense they are very clear. ADRs are different from side effects. Side effect is something which is never expected, and ADR something like that is what with the pharmacological activity of the substance drug. जिस दवा को हम इस्तेमाल करते हैं उसकी जो फार्माकोलॉजिकल एक्टिविटी से जुड़ी हुई चीज होती है, जो चंद लोगों में होता है, चंद लोगों में रुनवा नहीं होता, बट साइड इफेक्ट इज utterly different. So here 61% of the people says no, but the matter of concern is 25% of the people say yes also. Mean we are focusing about this is the issue. How to convince these people who are thinking that ADRs and drug side effects are same. We are focusing about the population which says side effect and drug ADRs are same. This is the issue, and the challenge is how to communicate them, how to convince them. And the challenges are we are just reaching to the population, trying to explain them side effects are different from ADR with this knowledge of terminology, like sir already told. Even I had in the presentation such a terminology. आइए एक और सवाल हमने पूछा, अगर आपने have you ever experienced, क्योंकि हम में से प्रैक्टिशनर्स बहुत हैं, टीचर्स हैं, टीचिंग इंस्टीट्यूशन, रिसर्च सेंटर्स में काम कर रहे हैं, तो हमने उनसे पूछा कि have you ever experienced adverse drug reaction in your patient during your professional practice? Then the response is it any problem, sir? Somebody is trying to contact me. Is it audible, visible?
Yes, sir. Yes,
yes sir, yes sir.
तो हमारा जो सवाल था हमने उनसे पूछा था कि आप अपनी प्रोफेशनल प्रैक्टिस में आपके पेशेंट्स को जो भी दवाई आपने दिए थे, have you ever experienced this ADR? See, more than nearly 50% population, 46% people say no. I don't believe people are unable to justify what is side effect, what is adverse drug reaction. That makes them in a state of confusion. As a result, we couldn't get the response. Majority of the people says no, that is less than nearly 50%, and 38.5% people say that yes. Then ultimately we pose another question. If you know आपकी practice में अगर आपको ADR महसूस हुआ है, तो फिर उसको मजीद क्या किया जाए? हमने उनसे पूछा, have you ever reported adverse drug reaction? Like अगर आपकी अपनी practice में आपकी निजी जिंदगी में कभी आपके अपने अजीजों के साथ या किसी मरीज या दोस्त अहबाब में भी कहीं किसी को एडवर्स ड्रग रिएक्शन हुआ तो आप क्या करोगे? तो देन इस सवाल से मुताल्लिक जवाब हमें मिला 686 people, mean a majority say that no, हमने नहीं किया. And this is another a big challenge. Why? Somebody said don't know how to fill up the ADR reporting form. Somebody said don't know where to submit the ADR form. There is a specific customized adverse drug reaction reporting form is there. We have only 225% people say yes, हमने report किया. आइए इससे मजीद और हमने बातें की. Because somebody has raised a question where to report, how to report, then we ask the question where to report an ADR related to ASU drug. Then we have given options here that you can submit to the peripheral center. Suppose the people who are staying in Lucknow, they can submit that ADR at the CRIU, there is a peripheral center. If you don't want, you can send online to the official website. We have one dedicated website that also is going to ask. You can go and ask the National Pharmacovigilance Center, Delhi. There are intermediate pharmacovigilance center, and above all, you can submit your response to any one of the above, because from base to upper level or from above to below, that regulatory authorities will take care of with information to all the linked people. Here the response what we got is 52.7% people say any one of the above. This is very right, because all sectors are responsible to consider the ADR form. ADRs when you report to them. Among the following, Dr. Tariq Mahmood sir has well told about that. Who is responsible to report the ADR? So डॉक्टर अगर दवाई तजवीज करता है तो मरीज नुस्खा ले जाएगा, फार्मेसी से दवाई ले लेगा, घर जाएगा, इस्तेमाल करेगा. So we have a series of the people involved. If it is outpatient case, sometimes if the patient was admitted to the hospital, doctor, nurses, dispensing people, and patient caretaker, ward boys, all the people are there. Here, the question arises that if the patient is admitted in the hospital or if the patient is taking treatment at the OPD level or at the residential level, who are the people responsible for? Here, the question we have designed and asked that here it includes. Doctor alone is not responsible to report the ADR. If the nurse who is taking care of the patient, they are also can respond. Patients, they themselves can go and submit their complaints to the peripheral pharmacovigilance center of the nearest doctor, or the pharmacist to whom the patient pursued and took the medication. They also can consider for response. I mean to say, the people to whom we have mentioned, all the people are responsible to submit the ADRs to the respective authorities. Here, luckily, we got 67.3% of the responses are right. So, जैसे तारिक साहब ने कहा था, और हम भी जानते हैं कि ADR का सीक्वेंस में पेशेंट अटेंडर, इसके अलावा फार्मासिस्ट, इस चैनल में जितने भी लोग हेल्थ डिलीवरी से जुड़े हुए हैं, वो तमाम लोग, all of them are responsible. They can go for reporting this one. And the question arises, is there any specific ADR reporting form for ASU drugs? जैसे यूनानी से लोगों ने हमसे पूछा, yes, there is a specific. We got 56% of the responses says probably these people have shown, they have evidences that हमने हर प्रोग्राम में, जब भी वेबिनार हुआ है, फिजिकल प्रोग्राम्स में, हमने लोगों में ADR फॉर्म तकसीम किए, प्रैक्टिशनर्स को उनके अपने ओपिनियन इनकॉर्पोरेट करते हैं, उसको इतना सहल बनाया हुआ है कि किसी भी डॉक्टर को, इवन एक ऑर्डिनरी मैन आल्सो कैन इनपुट ऑल द इंफॉर्मेशन इन द ADR फॉर्म. बहुत अगर कोई दिक्कत हो, we have mentioned that 24/7 what is called the toll free number, जिससे आप कांटेक्ट कर सकते हो, and this is a very easily. We happy to say 56% people say they have well versed with this specific ADR form. And the main question arises that Dr. Tariq Sir was talking about, that there are so many factors which are responsible for the manifestation of this what's called the pharmacovigilance like activity. This ADR, drug-drug interaction, sometimes drug-food interaction, drug and different substances interaction, environmental factors, comorbid diseases are there. So the one question we posed among all the people, is it mixopathy, mean combination of more than one drug? Either it could be a Unani or Unani and conventional modern drug, or Ayurveda, sometimes homeo. Can we allow to mix all these kind of drugs? And the responses are something like people say S. 47% people say that is S, and there is a state of confusion. 33% of the people are in a state of confusion, say maybe, हो सकता है, मुमकिन है, इस तरह के सवाल आ रहे थे. So this is the challenge for us. We have to convince the population, 33% of the population, how this mixopathy is going to do, because drug-drug interaction is a big chapter nowadays, and that is one of the reason and responsible for the major cause of the death in the Indian population, not only in the globally. And here we ask another question: do you think poor quality of drugs, prescription error, dispensing errors can also cause ADR? यहाँ इससे मुराद है कि जो दवाई बाजार में दस्तयाब है वो शायद क्वालिटी वाइज उतनी अच्छी नहीं होती. एक बज़ाफ़त ये होता है कि डॉक्टर, बहुत सारे अवामिल होते हैं जिसमें नफ्सियाती पहलू भी शामिल किया जा सकता है, या बहुत ही बिजी डॉक्टर्स बाज़ाफ़त जब नुस्खा तरतीब देते हैं तो कुछ ना कुछ चीजें गलती हो जाती है, कॉल्ड एज प्रिस्क्रिप्शन एरर. या मुमकिन है डॉक्टर खमरी के लिए एक नुस्खा तजवीज़ किया था, गलती से डॉक्टर आबिद के नाम चला गया और आबिद का मर्ज अलग था, डॉक्टर खमरी का मर्ज अलग था. This is called as the sometimes like a prescription error can also leads to the ADR. ऐसा भी हो सकता है. And another thing, dispensing error. दवा दो कि यहाँ फार्मेसी में जाइएगा, बहुत सारी चीजें looks alike, smells alike, जैसे बहुत सारी चीजें ऐसी एक जैसी मुशाबे रहती हैं. अगर मुफरदात की बात हो, आजकल मुरक्कब दवाओं की डब्बियां, बॉक्सेस, पैकेज इस तरह क्या है कि कंफ्यूजन में sometimes it happened dispensing error also. We have reported that, and the people started giving the complaint that 76% of the population says yes, there are responsible causes for the ADR, such like a prescription error, dispensing error. Poor quality of the drug is also played to be a very major role in what is called as the development of the ADRs. हमने ये भी उनसे सवाल किया, do you think that ADR results due to negligence from the side of there's an important part. Here is the ethical question, negligency. Sometimes prescription error हमने बोला, and dispensing error भी बताया. Negligency भी कहाँ किसकी negligency हो सकता है? So we made all the people, physician, primarily the doctor who is giving treatment, pharmacist who is dispensing the medicine, patient, the patient who is taking the medicine, sometimes paramedical staff, nursing staff, attendants. We said all of the above. In fact, the answer is all of the, not the none of the above. But here wrongly it is mentioned 70% people are in a state that all the people and their negligency also plays a very important role in the manifestations of ADR. Which of the following ADR should be reported? Like Tariq sir was talking about that ADR should be immediately reported because there is a brand specificity for the ADR. But now we have not grown to the extent. The reporting of the ADR is, we are trying to make it mandatory. We have to लाजमी तौर पे करवाना चाहते हैं so that आपकी साइंस हमारी तिब को हम बिल्कुल ये साबित कर सकें कि इसमें how much potential we have, how much what is called as the ADR free science we have. अगर हैं, what is the intensity? The question here will be concerned that based upon the intensity of the severity of the ADR, when to be reported. So सवाल हमें यहाँ मिला कि all the this is called as all the states, like if the ADR is mild, moderate, severe, तीनों सूरतों में भी लोग चाहते हैं कि इसको रिपोर्ट करना चाहिए. But do remember that all serious kind of ADR should be promptly taken care because sometimes these serious ADRs can lead to permanently disability of the life, or prolonged hospitalization, or sometimes comorbidities, or beyond that, sometimes it's life-threatening. It can lead to death also. If it is a mild to moderate, we can take time, but serious should be serious kind of ADR should be taken care on one-foot basis. Okay, but here we got the 69.4%, 70% people says all. Nothing is exempted, whether it could be mild or moderate or severe. All the kind of ADR should be reported. This is we agree. And do you think that reporting of ADR reaction? Okay, सवाल ये मतलब आज लोग बोल रहे थे कि why we should report. Some people that recently had a program. One of the person who was attending the program, he asked me if we started reporting the ADR, then we are going to make the graveyard for our own science. We are responsible for the damaging to our own system of medicine. This kind of a question I come across. If you started reporting the ADR, and one supposed to understand the nature of the ADR, then I think we have a clarity. मैं उस फर्द की इस ख्याल से इख्तिलाफ रखता हूँ क्योंकि उनकी सोच शायद मनफी की तरफ जा रही थी. अगर हम इसको बैनुल अक़वामी सतह पे स्थिति को अगर फरोग देना चाहते हैं तो दिस इज द नीड ऑफ द टाइम. इस वक्त की जरूरत है कि आप इन तमाम चीजों से वादे करवाइए, आगे करवाइए, दवाओं की लेबलिंग पे करवा दीजिएगा कि इस ड्रग से जुड़े हुए ADR क्या हो सकते हैं. So globally, people are ready to accept convention, the alternative system of drugs apart from the conventional system of medicine. तो इस बात को हमने मद्देनजर रखते पूछा था कि do you think that क्या आप समझते हो कि रिपोर्ट करना चाहिए? Is it necessary? People say that 84% people said yes. Really, I feel very happy. There are very sensitive, responsible people out there, but at the same time, 4% of the population said no. Somebody said can't say 4%. Maybe again is an ambiguity. किया जा सकता है. So opportunistic kind of the people are there. 8%. They said किया जा सकता है, नहीं किया जा सकता है. No, this is the target of our issues and the challenges. How to convince them, how to make them to be more sensitizing the objectives of the program. Then, do you think that ADR reporting should be made mandatory? अवाम नास के लिए नहीं बल्कि मेडिकल फील्ड के लोगों के लिए भी, जिसमें फिजिशियन को, फार्मासिस्ट को, नर्सिंग स्टाफ को, सबके लिए मैंडेटरी करना चाहिए. Yes, government is coming with an objective. In future, it will be a mandatory. 80% of the people says yes. As a physician, we and all of you and some of the students are the pharmacists, even the stakeholders like a pharmacist, pharmacy, drug developers also. It is making it mandatory to report it. Mandatory, lazmi ho jayega. And here we got 80% of the population says yes. 12% again maybe. हमने मजीद पूछा कि आप जहां जिस ऑर्गेनाइजेशन से जुड़े हो, अगर आप तालिब इल्म हो तो किसी इदारे से होंगे, आप किसी ऑर्गेनाइजेशन में काम कर रहे हो तो हमने उनसे पूछा कि आपके ऑर्गेनाइजेशन की नौयत से जानते हैं. उनसे पूछा is there any pharmacovigilance committee in your institute and workplace? Because pharmacovigilance has taken now it has a momentum globally. Most of the European countries and the developed nations they have established pharmacovigilance centers at their institutional clinical hospital level. Even India is also going to start the same thing there. So we ask it because 74 peripheral centers and other many more things are there. So toward this question, we got a response. Somebody said that 50% of the population says yes, we have Pharmacovigilance Committee. We don't know. We are looking to about this 50% people. What sort of a pharmacovigilance committee they have? Is it truly constituted, functioning? Objectives are also we are trying to look into that. 22% of the population says don't know. They don't have any idea. Clear-cut people, 18% say no, we don't have any other. Some of the 10% people say not formed. I mean they are about to form itself. Clearly, if you add together, 60% of the populations are about to accept the importance of the pharmacovigilance committees, right? And do you think the pharmacovigilance should be taught in the detail at all healthcare professional? Like अभी बात आ रही है कि निसाब में शामिल किया जाए, करिकुलम में फार्माकोविजिलेंस को शामिल करना चाहिए, है तो कहाँ पे? राइट नाउ आयुर्वेदा में तो पीएचडी लेवल पे काम हो रहा है, पीजी पे नहीं, यूनानी में भी पीजी लेवल पे कुछ ऐसा काम नहीं हो रहा है, and we are going to start soon to be subject to the apex body has to give its concurrence. ग्रेजुएशन लेवल पे क्या इसको फार्माकोविजिलेंस को भी निसाब में शामिल किया जाए, so that the people should be thoroughly versed in the knowledge of the pharmacovigilance. यहाँ लोग कहते हैं कि 89% of the population they are agree, yes, it is to be taught at the all healthcare professionals. It includes not only the doctors, nurses, pharmacists, paramedical staff. All the people should have. It is a must, like anatomy, physiology, and medicine. Similarly, with the pharmacology, one has to talk about the pharmacovigilance also. This is a very good initiation by the people. अगर ये है तो इस issue को कैसे cover किया जाए? How to convince the apex body? How to frame the curriculum? This is the challenge for the people, right? हमने मजीद पूछा कि have you ever read any article on prevention of adverse drug reaction? Because आज का दौर इंटरनेट का दौर है, हर छोटी चीज के लिए we are just searching, browsing, Google, xyz.com. Yeah, the people have started finding out that आपने कभी किसी ADR से related कोई पढ़ा, तो इस सिलसिले में हमारे पास कोई जवाब इस तरह है कि 55% of the population says that we often review articles on prevention of adverse drug reaction. This is about the consciousness about the people, because generally माना जाता है कि conventional drugs में ज़्यादा ADRs होते हैं, but one time we cannot deny also that alternative drugs also having similar kind of things. So people are looking about the articles, the information which is available globally about the public domain. Then coming to the important objective, this is the only objective which is we have in India. फार्माकोविजिलेंस प्रोग्राम दुनिया के मुख्तलिफ ममालिकों में शहरों में है, लेकिन हिंदुस्तान एक वाहिद मुल्क है जहां फार्माकोविजिलेंस के ऑब्जेक्टिव्स में मिसलीडिंग एडवर्टाइजमेंट को भी शामिल किया. दिस इज द ओनली कंट्री व्हिच हैज टेकन दिस मिसलीडिंग एडवर्टाइजमेंट एज ए वेरी इंपॉर्टेंट पार्ट एज अ पार्ट ऑफ द फार्माकोविजिलेंस प्रोग्राम. हमने सवाल किया मेनी आयुष मेडिसिन रिलेटेड एडवर्टाइजमेंट्स इन टीवी, आई थिंक टेलीविजन में, अखबारों में, इवन दिस व्हाट्सएप एंड डिफरेंट पब्लिक डोमेन्स में हमें देख रहे हैं कि पर्टिकुलर सिस्टम से रिलेटेड, यहाँ पे कोई यूनानी नहीं बल्कि हर सिस्टम से रिलेटेड देखा गया है कि न्यूज़पेपर, रोड साइड पोस्टर एक्सेट्रा में आर यू क्लेमिंग क्यूर फॉर वेरियस डिजीजेस? डू यू कंसीडर देम एज मिसलीडिंग एडवर्टाइजमेंट? हमने सवाल किया कि इस तरह की इश्तिहारात, इस तरह की जो तशहीर की जा रही है, हमने लोगों से पूछा कि आप इस चीज को मिसलीडिंग समझते हो, मानते हो? तो जो लोगों से हमें जवाब मिला 55% लोगों ने कहा कि यस, they're all misleading kind of advertisement, not to be promoted. 22% people said no, 15% maybe. This is an ambiguity. And then the further question we posed them, do you think misleading advertisement should be reported? अगर ऐसा है तो क्या उसको रिपोर्ट करना चाहिए? Answer is yes. Look at this point. Here we got 82% of the population saying yes, we have to brought it to the notice. इसको रिपोर्ट करना चाहिए. Then to whom to report? सवाल था, do you know that है misleading advertisement तो कहाँ किया जाए? हर स्टेट में स्टेट ड्रग लाइसेंसिंग अथॉरिटीज होती हैं. They are the people responsible for giving license to the manufacturers. तो इस पे हमें जो जवाब मिला, people say that only 26% of the population says that it's state licensing authority. ये बहुत ही हमारे लिए बड़ा अफसोस की बात है कि हमने हर प्रोग्राम में इस बात को शामिल किया क्या मिसलीडिंग एडवर्टाइजमेंट को कहाँ करना चाहिए, कैसे रिपोर्ट करना चाहिए, लेकिन हम लोगों तक पहुंच नहीं पाए इस बात को लेके, इस जवाब को लेके. एंड नाउ वी आर फोकसिंग ऑन दिस पॉइंट विद मोर enthusiasm, how to make the people to be sensitizing about the drug licensing authority is the one who is responsible for controlling such a misleading advertisement published in either electronic and digital media. बहुत सारे लोगों ने कहा yeah, any of the above नहीं, this is 34 is very poor, wrong. Only 26% people says state drug licensing authorities. हमने फिर उनसे पूछा कि अगर आपने मिसलीडिंग एडवर्टाइजमेंट देखा है, आपने कभी कहीं रिपोर्ट किया, से 92% people accept that no. क्यों? Only 8% of the population said that we have reported. Even we are not sure. We are just accepting their statement, yes or no. Maybe some of the people they don't have the clarity, but the data says that 92% says that हमने कभी misleading advertisement को नहीं किया. मैं यहाँ एक बात कहना चाह रहा हूँ. टीबी यूनानी के किसी प्रोडक्ट को अगर गलत तरीके से कोई तशहीर कर रहा है, उसके बाद अगर कोई एडवर्सरीज हो जाए सोसाइटी में, नुकसान हो जाए, तो अल्टीमेटली सिस्टम बदनाम होगा. अगर इसकी तशहीर किसी पोस्टर के जरिए या किसी इलेक्ट्रॉनिक या डिजिटल मीडिया के थ्रू किया जा रहा है और वही आपके सिस्टम के लिए ड्रॉबैक अगर बन जाए, डू यू फील इट इज अ प्राइड फॉर अस? No, I don't think so. The people won't accept. So it is our responsibility whenever you come across this kind of thing, please report it. Right? इंडिया में ये बड़ी बिल्कुल लिटरली क्वेश्चन है कि यहाँ हिंदुस्तान में जब मिसलीडिंग एडवर्टाइजमेंट जैसी चीजों को कंट्रोल किया जाता है, तो उसके लिए कोई कानून बना होगा. हाँ, there is an act called as Drug and Magic Remedies Act 1954, जिसमें वाज़े तौर पर दिया हुआ है कि 52 डिजीजेस ऐसे हैं जिसकी तरतीब से लिस्ट भी पाई गई है, उसमें कोई भी बंदा किसी भी तरह का अपील नहीं कर सकता कि मैं इसका शर्तिया तौर पर इलाज करूंगा. टीबी यूनानी बड़ी बहुत ही बदनाम है, अक्सर लेके सेक्सुअल मेडिसिन से रिलेटेड एंड बहुत सारे क्रॉनिक डिजीज के लिए लोग बड़े शर्तिया इलाज करते हैं. बहुधा ये तमाम चीजें ऐसी हैं कि गवर्नमेंट ने इन पे पाबंदी लागू की हुई है. अकॉर्डिंग टू ड्रग एंड मैजिक रेमेडीज एक्ट 1954, यू कैन नॉट क्लेम एनीथिंग लाइक दिस, एंड इफ यू आर डूइंग चैलेंज एंड यू आर वर्किंग लाइक दिस एक्ट नहीं करना चाहिए. हमने लोगों की नॉलेज को महसूस करने की कोशिश की. सो वी गॉट दैट ओनली 22% ऑफ द पीपल नो अबाउट दिस. ये बाय वे चांस आर लिटरली बहुत लोग जानते होंगे. अगर जानते हैं तो then they have to be very careful. I request all the people who responded positively to communicate other to not to be indulge this kind of activity or to take care of preventing such a misleading advertisements. Okay. Yeah, this is 27%, 27.4% people are involved in the magic replica. They know about it. Okay. Have you ever been subjected to pharmacovigilance? This is the very fundamental question. आज के इस प्रोग्राम में करीबन मेरे ख्याल से 100 से ज्यादा लोग हैं, करीब 100 लोग इसमें शिरकत करे हुए हैं. हमने इस तरह के करीबन 3 दर्जन प्रोग्राम मैं एज ए कोऑर्डिनेटर इसमें शिरकत किया हुआ हूँ. और हिंदुस्तान में और दीगर तिब्के भी लोगों ने विदाउट कंसिडरिंग दिस अवेयरनेस टू पर्टिकुलर सिस्टम, लाइक मैं आज यूनानी पे मैंने काफी बातें की, बट हमारे ऑब्जेक्टिव्स सबके एक जैसे हैं. आयुषु के, आयुर्वेदा, यूनानी, सिद्धा, स्वरिपा, होम्यो, सबके ऑब्जेक्टिव्स एक ही हैं. तो हमने ये जो प्रोग्राम्स कंडक्ट करवाए, काफी लोगों ने इससे इस्तेफादा हासिल किया. तो हमने काफी लोगों से जब ये सवाल पूछा तो हमें वी गॉट वेरी marginal difference of 50%, around near 50% people say no. जबकि हिंदुस्तान में करीबन 50,000 रजिस्टर्ड प्रैक्टिशनर, 2,500 से ज्यादा लोग फारिग हो रहे हैं, ग्रेजुएट हो रहे हैं, रिसर्चर्स हैं. इतने बड़े अजीमुशान मुल्क, और हमने दावे के साथ कहा कि इंडिया इज द ग्लोबल कैपिटल फॉर यूनानी मेडिसिन. जबकि हमने खुद 3 दर्जन प्रोग्राम अवेयरनेस के करवाए, बावजूद उसके सिर्फ हमने 55% लोग इस बात का जवाब दे रहे हैं कि हमारे प्रोग्राम में शिरकत की. So the objective of the program is to make you to be aware of this. I hope that कि आप लोग हमारी मदद करोगे इस गर्ज से कि हम अपने टिप को वाज़ेह तौर पे बैनुल अक़वामी सतह पे कबूल करने के लिए, मतलब जो the people can accept globally. And the one another question we ask, जैसे आप अगर ADRs हो तो कहाँ उसको रिपोर्ट करना है, तो पेरिफेरल सेंटर की बात बताएं. अगर आप किसी कस्बा गांव में रहते हो, तालुक में रहते हो जहाँ से किसी पेरिफेरल सेंटर नहीं है, nowadays we are very much used to with this internet. तो ayushsuraksha.com एक वेबसाइट है, डेडिकेटेड वेबसाइट है, गवर्नमेंट ऑफ इंडिया, मिनिस्ट्री ऑफ आयुष की तरफ से जो लॉन्च किया गया है. यहाँ जाइएगा, then there is a dedicated digital form is there, so you can submit all the information and your confidentiality will be taken care, and the representative from the rear end will contact you, and आप जिस इलाके में वहाँ के नियरेस्ट लोग आपसे कांटेक्ट करेंगे and they will try to assess the nature of ADR. इस सवाल के जवाब में हमें सिर्फ ओनली 38% लोगों ने जवाब दिया हुआ है, राइट आंसर था, जबकि 53% पीपल आयुष pharmacovigilance.com, जबकि इस तरह का कोई वेबसाइट मौजूद ही नहीं है. मे बी देयर इज अ कंफ्यूजन, एंड हम चाहते हैं कि एज ए आवर ऑब्जेक्टिव इज टू मेक अवेयरनेस, लोगों को ट्रेन किया जाए, लोगों से मुराद यहाँ से मुराद हेल्थ केयर प्रोफेशनल्स को एजुकेट किया जाए, ऑब्जेक्टिव से आगाह करा जाए. We have wanted to develop a culture of reporting the ADR. So we are coming forward and we need all the people support, and this is one dedicated website through which you can do. अल्टीमेट ऑब्जेक्टिव ऑफ द प्रोग्राम, हमारे वेबिनार्स का मकसद ये है कि हमारी जो स्टडी से हमने जो स्टडी कंडक्ट करवाया था, जिसमें मोस्ट ऑफ द पीपल आर फॉलोइंग इन द गुड क्वालिटी, गुड कैटेगरी 38%, और एक्सेलेंट इज ओनली 30% ना, वेरी पुअर 17% थे। हम इन तमाम लोगों में इंप्रूवमेंट चाहते हैं, पुअर की तादाद घट जाए, एक्सेलेंस बढ़ जाए, लोगों में नॉलेज ऑफ दिस फार्माकोविजिलेंस वाज़ेह तौर पे समझ में आ जाए। अगर आप अपने जिस किसी भी सिस्टम से आप ताल्लुक रखते हो, वी विश टू सी द इंप्रूवमेंट, अंडरस्टैंडिंग, क्लियरेंस एंड लिटिल बिट अकाउंटेबिलिटी ऑफ रिपोर्टिंग ऑल दिस थिंग्स। फाइनली द कंक्लूजन इज, जबकि हिंदुस्तान में सिंस 2018 से फार्माकोविजिलेंस प्रोग्राम फॉर आयुष ड्रग फंक्शनिंग हो रहा है। इस ड्रग्स के तहत आज तक करीबन 74 पीपीवीसी, 5 आईपीवीसी काम कर रहे हैं। ऑब्जेक्टिव्स हमारे यही है कि टू प्रोवाइड सेफ ड्रग्स एंड पेशेंट केयर। Totally the patient care is here important and to save drugs to be given. इस घर से हमने several awareness programs करवाए, जो physical भी रहे as well as virtual भी रहे। घर जो गाइड यही रही कि to sensitize the stakeholder। यहाँ stakeholder से मुराद practitioners, students, pharmacy, drug developer, everybody is here. And the insight of the present survey is, हमने जो कुछ किया करवाया है, to organize more awareness programs and make stakeholders accountable to reach the objectives. This is what my purpose of discussion and deliberation. Thank you for patiently listening to me.